Hello, I'm Dr. Jeffrey Hayes, the ASRM Education Specialist, and today I'm going to review our Ethics Committee opinion on ethical obligations in fertility treatments when intimate partners withhold information from each other. Patients look for answers, and healthcare providers often find themselves faced with ethical questions that need answers regarding disclosure. This topic on ethical obligations in patient disclosure is important because several broad categories of harm can occur when intimate partners fail to disclose material information regarding themselves. Open communication between a couple and the physician is important. Clinicians should encourage couples presenting for fertility treatment to disclose to one another relevant information that can affect their reproductive decision-making. The HIPAA privacy rule allows physicians to share medical information with family or friends if they are involved in a patient's health care or payment for that patient's health care, as long as the patient does not object to sharing this information and permission is given to do so. To avoid misunderstandings, many physicians have patients sign a HIPAA privacy rule waiver that gives them permission to share all clinically relevant information with both reproductive partners. Ideally, the reproductive couple should sign a waiver allowing for their physician to share all clinically relevant information with both reproductive partners. This would include information provided by either member of the couple, as well as information discovered during evaluation and treatment. The waiver should set forth the clinic's policy on disclosure of clinically relevant information, including disclosure in the absence of the patient or partner's further consent. If either member of the couple is unwilling to sign the waiver, physicians should explain any limits to care, including the possibility that they will be unable to provide care if protecting the confidentiality of one partner precludes informed consent on the part of the other partner. Cases may arise in which a patient shares information with the clinician and asks that this information not be shared with their intimate partner. In such cases, physicians are both ethically and legally bound to maintain patient confidentiality, except as otherwise provided by law. When confidentiality cannot be kept, for example, because of state reporting requirements, the patient should be told this, ideally before the information is even obtained. In such situations, it is ethically permissible for the clinician to decline care. In cases where lack of disclosure can cause harm to the patient, their intimate partner, or their offspring, the clinician should strongly encourage disclosure. When patients refuse to disclose information to their intimate partners, and proceeding with fertility treatment could cause harm to the patient, partner, or offspring, clinicians may refuse to offer reproductive care. Clinicians are ethically obligated to decline to provide care when the circumstances are such that fully informed consent for the proposed treatment cannot be given because the patient would be subjected to risks that cannot be disclosed without violating clinician-patient confidentiality. Lack of information sharing between intimate partners can impede a physician's ability to obtain fully informed consent from both members of the couple. Potential impacts on informed consent include the physician's inability to fully discuss the range of possible treatment options, as well as the risks and benefits of the proposed treatment. In such cases, clinicians may proceed or decline to offer treatment, and should make such judgments in a non-discriminatory fashion and without bias. In cases where the information, if disclosed, might be relevant to the partner's decision whether to undergo fertility treatment, the clinician should also strongly encourage disclosure between intimate partners. This includes situations in which fertility treatment is required that could otherwise have been avoided if certain information had been shared. In summary, encourage open communication regarding relevant disclosure information between partners and yourself. Have a waiver. Obtain disclosure from both parties whenever possible. If you cannot, then weigh and discuss risks associated with lack of information. If you cannot obtain relevant disclosures, you can ethically justify declining care. However, remember that in declining care, that it is ethically justified so long as no harm is done by refusal of care. While it is unlikely that these scenarios could be emergent, the onus to provide care would be different if declining care could cause harm.